The pancreas is a crucial digestive gland. It produces enzymes which break down carbohydrates and fats, enabling hormones to synthesize and circulate throughout the circulation system in your body. The pancreas is essentially one of the digestive system's cleaners. This year alone, over 60,000 Americans will be diagnosed with pancreatic cancer, and almost 50,000 will die from disease-related complications. Approximately 90% of instances occur in persons over the age of 55. Pancreatic, kidney, ovarian, and brain tumors are all fatal and detected way too late. Pancreatic cancer is probably the most difficult to recognize early symptoms. Before we continue, please remember to like and subscribe. Let's get into it. Where is the pancreas located? The pancreas is located behind the stomach and the small intestines in the upper abdomen. A duct connects the pancreas to the first segment of the duodenum, which is attached to the stomach. This connecting duct is responsible for transporting pancreatic enzymes to the intestines. What is the pancreas's function? The pancreas's sole function is to produce digestive enzymes, which aid in the digestion of food, and to produce hormones that control our metabolism. These hormones are then released into the bloodstream. They function as messengers affecting distant cells and tissues. Approximately 90% of the pancreas is devoted to producing digesting enzymes. These enzymes are produced by cells inside the pancreas known as acinar cells. Enzymes contribute to the reduction of proteins, lipids, and carbohydrates. This facilitates intestinal absorption of certain minerals. The acinar cells also produce a liquid that facilitates the activity of pancreatic enzymes, also referred to as pancreatic juice. The following enzymes are produced by the pancreas: pancreatic protease, including trypsin and chymotrypsin, which aid in protein digestion; pancreatic amylase aids in the digestion of carbohydrates and sugars; and pancreatic lipase, which aids in fat digestion. Approximately 5% of the pancreas produces hormones that assist in regulating your metabolism. Within the pancreas, these hormones are produced by several distinct cells that cluster together like small islands. The islets are known as islets of Langerhans, and an adult's pancreas contains around 1 million islets. These hormones are produced by cells in the pancreatic islets of Langerhans. Insulin, which helps to manage blood sugar levels. Glucagon, which interacts with insulin to maintain normal blood sugar levels. Somatostatin. This hormone helps regulate the release of other hormones, and gastrin, which assists in stomach digestion. Although the symptoms of pancreatic cancer may only present themselves when you have been diagnosed, looking out for 2 or more of the symptoms we are going to show you should urge you to visit your healthcare professional to get tested for this silent killer. Number 7. Blood clots. According to the American Cancer Society, blood clots may be an early sign of cancer. Those with pancreatic cancer are more likely to develop deep vein thrombosis, or DVT, often known as blood clots in major veins, typically in the legs. A fragment of the clot may break off and get lodged in the lung, creating a potentially deadly pulmonary embolism. People with DVT should have a full body examination and blood tests to rule out any underlying diseases. Number 6. Ascites. Ascites is a disorder that manifests itself as a bloated or distended abdomen and is brought on by an accumulation of fluid in the abdominal cavity. Sometimes liters of fluid may accumulate in the gap between the organs and the abdominal wall, which is bordered by a membrane known as the peritoneum. This can be quite dangerous. Ascites may bring on excruciating pain and can make breathing difficult. It can appear at any stage of pancreatic cancer, but they are often linked with later stages of the disease. Number 5. Sudden weight loss. In most cases, maintaining a healthy weight may be accomplished by proper nutrition. However, a rapid loss of weight that is not caused by any external circumstances, such as a medical emergency or a change in lifestyle, may be cause for worry, particularly for individuals who are over the age of 55. If you are maintaining your typical eating habits but still losing weight, this should be something that you notice. Get an urgent consultation with your primary care physician. In certain cases, people who have pancreatic cancer have very little or no appetite, which plays a role in their gradual loss of weight. Number 4. Anxiety and depression symptoms. Both anxiety and depression have the potential to be early warning signs of a more serious underlying medical condition. Anxiety is one of the possible earliest manifestations of a variety of medical problems, one of which is pancreatic cancer. A study carried out in Sweden discovered a connection between mental disorders and cancer diagnosis that came before them. One idea suggested a tumor-related condition might generate a fake neurotransmitter that has the power to change a person's mood, despite the fact that there is insufficient data to support this claim. Number 3. Unexplained fatigue. Fatigue for no apparent cause is a red flag that something may be amiss and is a warning symptom for cancer in general. The fatigue that is brought on by pancreatic cancer is not your typical tiredness. Rather, it is characterized by a dramatic decrease in normal levels of energy, both intellectually and physically. This might include anything as varied as having issues getting out of bed or having trouble walking to the end of the driveway. Contact your physician if you are still feeling tired after getting the recommended amount of sleep each night and regularly engaging in physical activity. Number 2. Upper abdominal pain. There is a possibility that a tumor is located on the pancreas if there is a dull discomfort that is located in the abdomen, as reported by the Johns Hopkins Medical Center. When a tumor is located on the tail of the pancreas, it presses on the spine, which may cause the patient's discomfort or extend it to their back. After eating, this ache is more intense than it was before. Number 1. Jaundice. The accumulation of bilirubin, which is a component of bile that is generated by the liver, is what leads to jaundice. Additionally, this condition might be a sign of pancreatic cancer. This condition may arise if a tumor clogs the bile duct that runs from the pancreas to the liver. In addition to causing a yellowing of the skin and eyes, high levels of bilirubin in the blood may also produce itchy skin, dark urine, and pale or clay-colored feces. These symptoms can appear when bilirubin levels become elevated in the body. It is essential to note that not all people diagnosed with pancreatic cancer will develop jaundice, since the severity of the condition is directly related to the size and location of the patient's tumor. However, if you have jaundice or any other symptoms of pancreatic cancer, or if you have risk factors connected with pancreatic cancer, it is imperative that you speak with a doctor to confirm a diagnosis. Pancreatic cancer risks include having a family history of pancreatic cancer. What causes pancreatic cancer? A single aberrant cell may start the development of a malignant tumor. It is not known for certain why some cells develop into malignant ones. It is hypothesized that something inside the cell causes some genes to become damaged or altered. Because of this, the cell becomes aberrant and begins to proliferate uncontrollably. There doesn't seem to be an obvious cause for why so many individuals get pancreatic cancer. On the other hand, the presence of certain risk factors make the development of pancreatic cancer more likely. These are the following. Aging. It is more prevalent in adults of advanced age. The majority of instances are seen in patients older than 60 years. Smoking. Diet. It seems that an increase in risk is associated with consuming a diet that is heavy in fat and meat. Obesity. Alcohol. Many instances of chronic pancreatitis are brought on by excessive use of alcohol. Chemicals. There is a possibility that the danger is increased when workers are exposed to high levels of certain pesticides, dyes, and chemicals used in the refining of metals. Issues related to genetics and heredity. Most instances of pancreatic cancer are not passed down through families. On the other hand, the risk of pancreatic cancer in some families is much greater than the national average. It is estimated that around 1 in 10 cases of pancreatic cancer may be traced back to the inheritance of a mutated gene. As always, prevention is better than cure. But is it possible to prevent this deadly cancer? Reducing the risk factors for pancreatic cancer that are within your control is the most effective method for preventing the disease. Smoking is one of the major risk factors that may be controlled by the individual. Those who smoke have a greater risk of developing pancreatic cancer than those who do not smoke. According to research, this occurs because the carcinogenic compounds of cigarettes are absorbed into the bloodstream, where they cause harm to the pancreas. Put an end to your smoking habit if you want to reduce your chance of developing pancreatic cancer. You should not begin smoking if you have never done it before. Reduce your use of alcohol by a significant amount. Consuming large amounts of alcohol may raise the chance of developing pancreatic cancer. In addition, cirrhosis, which is a condition that may be brought on by excessive use of alcohol, has been connected with an increased risk of pancreatic cancer. It is imperative that you cut down on the amount of alcohol that you consume on a daily basis. If you don't drink already, there's no need to start, and drinking alcohol should not be something you do on a regular basis. According to the recommendations provided by dietary guidelines, women should limit themselves to no more than 1 drink per day, while men should limit themselves to no more than 2 drinks per day. Obesity is considered to be one of the risk factors for pancreatic cancer. You may get your weight loss journey started by engaging in physical activity and developing a healthy eating plan. Make an appointment with your primary care provider to discuss a diet and exercise regimen that is tailored to your specific needs. According to the results of several preliminary studies, eating an excessive amount of red meat may be associated with an increased risk of pancreatic cancer, particularly in males. Reduce your intake of red meat such that you only consume it once or twice a week. Eat more fish and poultry without the skin and cutlets instead of red meat. It has been shown that eating processed meats raises the chances of developing pancreatic cancer in a person. Meats that have been altered in some way to make them last longer in storage, such as by smoking, curing, adding an excessive amount of salt, or adding preservatives, are considered processed meats. Your consumption of processed meats like sausage, bacon, hot dogs, salami, beef jerky, and ham should be restricted or eliminated entirely if you want to reduce the possibility of developing pancreatic cancer. Visit your primary care physician as soon as possible if you have any of the symptoms associated with pancreatic cancer. Talk to your doctor about what else your symptoms may signify so that you can have a better understanding of what's going on with your body and why you're experiencing certain things. If you have a family history of pancreatic cancer or other risk factors for the disease, you should plan an appointment with your primary care physician to check on how well you are doing overall. There is no one way of prevention that will absolutely guarantee that you won't get pancreatic cancer. They will only assist you in reducing the likelihood of something happening. Please watch these videos for more of our content. Please like and subscribe, and thanks for watching.